Sickle cell disease is an inherited blood disorder which affects the body's red blood cells, preventing them from efficiently carrying oxygen. Unlike normal red blood cells, sickle-shaped cells are fragile, block blood vessels, and die much faster than the body can replace them, leading to severe pain, chronic anemia, and damage to vital organs. For many Ugandan families, the burden goes beyond illness. Frequent hospital visits, costly medication, and loss of income continue to strain already vulnerable households.
Sickle cell disease, by the way, is a very big problem. In Uganda, we have about 20,000 children who are born with sickle cell disease, and up to about 80% of these die before the age of 5.
The burden at the sickle cell clinic has increased over the last 5 years. You see close to around 20 new cases per week of sickle cell disease. And as a result of that, the number of clients who come to the clinic has increased.
However, doctors at the Joint Clinical Research Center say hydroxyurea has transformed the lives of many children from as young as 9 months by reducing painful crises and hospital admissions.
We are doing research to look at newer or better molecules than what is available on the market today, which is hydroxyurea. Hydroxyurea is the drug that we give children from 9 months. But when you give this drug hydroxyurea, you also give it with other things like Fansida to prevent malaria, because the malaria can cause also blood loss, and yet they already have an underlying problem. But we've also seen patients who don't respond to hydroxyurea. So as a research institution, we are looking at other molecules that we can evaluate, and we have at least 2 studies that are ongoing.
Yet amid the challenge, medical advances are rewriting the story. They say the biggest breakthrough would be establishing Uganda's first bone marrow transplant center, currently the only treatment with the potential to cure eligible sickle cell patients.
But at the same time, as an institution, we are looking at treatment is good. It should be started early, so people should know their status. But again, we are also looking beyond treatment to curing sickle cell disease. Sickle cell disease can be cured by bone marrow transplant. We are establishing a bone marrow transplant center in Uganda to be able to provide cures for sickle cell disease. We will be starting the implementation. We are looking for $4 million, and we have a fundraising drive that is out.
Today, families must travel abroad, mainly to India, at costs few can afford. For thousands of Uganda's children, investing in this center could mean the difference between a lifetime of suffering and a future filled with hope for a disease that has silently claimed thousands of young lives. The solution may already be within reach. The question now is whether Uganda will invest in turning medical possibility into reality. Crispus Adinitwe, reporting for UBC.